So, welcome back to this NPTEL course on additive manufacturing. So, this is one of the case study that I will be discussing on 3D printing of ceramic dental implants. So, as the title of this particular lecture mentions dental implants. So, first I will introduce you to the dental implants, and then I will show you some of our most recent research results as part of a large translational program involving manufacturing partner, that is a startup company based in Hyderabad, as well as these three clinicians based in 3 different hospitals, one at Rama University Applied Science, one at KGMU, King George's Medical University, and one at Datta Mega Institute of Higher Medical Sciences, Wardha in near Nagpur in Maharashtra. I will be showing you some of the results so that you know that how this research has taken up from design to clinical study, clinical outcome. And then I will also show you that our work on the 3D printing of ceramic implants. So, having said that, this is the topics that will be covered: clinical treatment of tooth loss. Tooth loss, it can be single tooth loss, it can be multiple tooth loss, and this tooth loss, the clinical term is edentulism. So, introduction to dental implants. So, one of the treatment option is that use of dental implants, conventional and additive manufacturing of dental implants, that I will show you, surface treatment, how the implant surfaces are being treated, performance limiting property assessment like insertion torque study, fatigue study, preclinical and clinical study. So, as I said that I will show you very briefly some of the clinical outcome of the patients are being treated with the make in India implants or indigenously manufactured implants in India on Indian patients. So, therefore, those images should not be may disturb to some viewers. So, our apology for that, and these will contain open mouth intraoperative images and some clinical images or video with human blood. So, if this some tooth is missing here, right. So, essentially both the sides this will be compressing, and when you try to bite certain food particles, you have to apply the force from the top, you have to apply the force from the both the sides in order to crush and grind during the mastication process, right. So, if there is no teeth loss, so the any human being can eat properly. So, then if you have an implant and if you have a tooth loss, then one of the treatment option is this placing the implant and then putting the prosthesis, right. So, advantages of dental implants, it essentially restores partial or complete edentulism, toothlessness, as I said before, maintenance of the alveolar ridge height and width, maintenance of masticatory efficiency, and also facial aesthetics. So, now when these implants are being manufactured by conventional manufacturing technique or 3D printing technique, one should know what would be the sizes, right. So, it is as I mentioned before that you know that if you do cranioplasty surgery for cranial treatment, I think I have shown you some case study on that, then you have noticed that this cranioplasty bone flap must be patient specific. That means no single size fits all, but the dental implants which is for public health care, this typically our jawbone anatomy essentially, if you carefully consider the jawbone anatomy, particularly maxilla and mandible is a lower jawbone and maxilla is the upper jawbone. There are specific sizes of these particular implants. So, for example, anatomical location with respect to size. Now, if you look at this top part, this one of the cross section has been shown here. So, if you look at this particularly top part, it is 3.77 mm and length is 8 to 12 mm. So, most cases, most of the implants that the patients need, and then according to our experiences is around 4.2 mm, 4.2 to 4.7 mm diameter, and length is 6 to 8 mm. Then comes this lower mandible, that is lower jawbone, that is mandible, it is 4.7 to 5.5, and then also 3.7 to 4.2 mm. And this length, as you see, it can vary between 8 to 12 or 10 to 14 mm, and diameter it can vary from 3.7 to 5.5 mm, right. So, this has been, this particular image has been essentially constructed using Sarvia, that is the open source platform that we have used. So, what is a dental implant according to the FDA definition, that is US Food and Drug Administration definition. This an endoosseous dental implant is intended to be surgically placed in the bone of the upper or lower jaw arches and to provide support for prosthetic devices such as artificial teeth in order to restore a patient's chewing function. That is the FDA definition. And you can see this is that implants, right. It has been shown like it has been placed in the lower jaw. So, classification based on the implant placement in tissues, it can be classified epiosteal implants, transosteal implants, as you can see here, epiosteal implants, transosteal implants, and endosteal implants. Okay. So, endosteal implants, you can see that is a 2-piece or 3-piece implants that has been shown. So, biometers for implant assembly, either metallic implants or non-metallic ceramic implants like alumina, zirconia or zirconta and alumina, and metallic implants is stainless steel, Ti6Al4V and so on. So, end to end technology development for dental implants. So, design and manufacturing of implants. Then comes in silico biomechanical assessment. For any new implant design, one has to do finite element analysis to show that if the implants is virtually implanted into the jawbone, what would be the von Mises strain that will be generated, and whether it will be in clinically acceptable bone remodeling range. Then the surface treatment. So, if the surface treatment is done, how that will influence the biocompatibility property of this materials. So, therefore, in vitro cytocompatibility, in vitro means experiments which are conducted using glassware. Then comes performance qualification assessment like insertion and removal torque. So, there you can use the porcine bone or human cadaver bone just to show that when you will essentially implant these materials, what are the kind of torque that you need to place that implant. Then in vivo biocompatibility and osseointegration, and pilot clinical study, clinical evaluation in human subjects. Now, I come back to this jawbone anatomy which I have shown you few slides back, just to explain you that in the jawbone, in the both maxilla and mandible, that there is also bone density that will vary. So, bone density in this dental implantology often follows misclassification. So, first of all, if you look at this femoral bone structure, right, large femoral structure, you have a cortical bone, that is outer cover, you have a cancellar bone, cancellous or trabecular bone, that is a spongy structure. So, here bone density in this particular region, bone density will be lower, and this cortical bone density will be higher. And in the dental implantology, people use D1 bone, D2, D3, D4. D2, D3, D4, basically D1 is much stronger, D1 bone, D4 is much weaker bone, that means bone density is fairly low. And if you look at this maxilla region, so D2, D3, D4 are very commonly or very much clinically observed bone density or clinically recorded bone density in human patients in the upper jawbone maxilla region. Now, in other parts you have either D2, D3, and in some of the edges of the lower jawbone you can have D1 and D2 bone. So, from these two slides, this one and similar slides where I have discussed jawbone anatomy, you have much clearer idea. I am talking about, I am referring to this particular slide, right. So, here I have discussed about implant sizes, right, and here I am essentially discussing you about the bone density. So, you know that when you manufacture the implants, what would be the various sizes that you require, that are required to be manufactured, and then when you place those implants in the human patients, what are the range of bone density that essentially you can encounter. So, this is not only implant sizes, but also bone density, which are to be taken into considerations during this implantation in human patients, right. So, here again this particular sketches and schematic was used, we have used the Sarvia. So, implant, dental implants, so we can have single piece implants like this, and we can have one piece implants like this, like it can be ceramic implant or metallic implant. You can have two piece implants, 2 and 3 piece dental implants, that has been mentioned here, and there can be different implant types. For example, this is a perfect cylindrical type of implants, right. There is a single straight screw dental implants, and there is a conical dental implants, right. So, you can see that essentially apical part is very much conical shaped. And what are the implant component? You have the top part is a prosthetic tooth. So, this is also called crown, but dental implantology often people use the word prosthesis. So, whenever they mention prosthesis, they essentially refer to crown. Then you have a locking screw and you have a healing abutment. This healing abutment is to be placed inside after few weeks of the placing the implants. So, first is actually first step is the step 1 is the placing the implants. Second step is the placing the abutment and locking screw, and third one is the prosthetic crown. So, you can see this is the complete placement of this essentially dental implants with prosthesis, which are used for the treatment of edentism. And these are ceramic implants. This is a single piece implants which goes directly into the implant, and on the top of it you have the prosthesis called crown, which can be placed. So, a 3 piece dental implant consists of abutment, screw and locking screw, and a synthetic tooth or crown is placed on the abutment. Okay. So, types of root form of this one that I have shown you in the last slide, that it can be either cylindrical or with or cylindrical or very blunt. It can have a straight screw dental implants and conical screw dental implants. So, one thing I must mention here, that implant design, if you bring novelty in the implant design, then it must be supported by clinical evidences. It must be supported by the preclinical evidences with respect to already clinically used implants with different design concepts. So, any patented designs, or whenever you want to patent any design, that patentable design must, their efficacy must be supported by the preclinical and clinical evidences. So, this is just a 2-stage, this is a video of the 2-stage surgery. You can see that if the tooth is lost, now this part we have identified, you can get the CBCT image, and then you can essentially see what is the bone density and so on. Then you make a cavity right there, cavity to place the implants very carefully, you will see that. And then after few weeks, then you put this abutments, cover screw, everything, and then after few weeks you can put the essentially crown at the same place. Okay. So, once you place the crown, then patient's original mastication property, original mastication, they can I mean that is restored. So, there are 2 type of implants which are currently used, metallic and ceramic dental implants. So, by far around the world, titanium dental implants is most commonly used, whereas ceramic implants have started penetrating the market, and ceramic implants are also used are also increasingly being used mostly in European countries and also Western countries. So, titanium implants, one of the main thing is that this is a vast scientific evidence or clinical evidences for good osseointegration. It has a good strength and durability properties. Easy machining, it can be done in the conventional machining, it is versatile, it is available 1 piece, 2 piece, 3 piece, total rehabilitation, corrosion and less aesthetic often is an challenges, often are challenges or issues. Ceramic implants, it has a better aesthetics, better osseointegration, soft tissue attachment is very good. So, there is no metallosis. So, in titanium implant for longer term uses, in some of the clinical cases people have reported the evidences of metallosis, whereas it is ceramic implants metal free. Mechanical reliability, complex manufacturing, single piece dental implants that must be used usually for, and also cost. Those are, I have put a star mark just to show this can be often be challenges to take ceramic implants to a very significant extent to clinics, right. So, you can see this is a single piece ceramic dental implants and these are like metallic implants as we have seen before also these kind of sketches. So, types of dental implant surgery, implantation procedure. So, first is the tooth extraction, damaged tooths, then implant is placed, then abutment is placed, then crown is placed, this third stage, right. And implant system, as I said, it can be single piece immediately loaded implant or it is like a double piece. So, two-piece surgery is that two-stage surgery. So, tooth extraction, implant placement, cover screw placement. Then you essentially allow healing to take place depending on the patient's conditions is around 12 to 16 weeks, sometimes even it is shorter. Then healing abutment is placed, the gingival former, then abutment is placed, then crown is placed. So, there is two type of loading conditions like crown loading I am talking about. Whenever you are talking about loading, we are essentially refer to crown or prosthesis, immediate loading or delayed loading. Immediate loading means immediately after the implantation, delayed means after few weeks as I have mentioned before. Now, one of the main thing that when you place any implants that stress shielding can take place depending on the bone conditions, the host bone conditions as well as that implant properties. Now, stress distribution is, this is essentially shown to the cortical bone. So, when you place the implants, there may be displacement locally in this host tissue or host bone areas that has been shown here. So, you have the cancellous bone and you have a cortical bone. A few years later, if you see the cancellous this implant when it is integrated, you can see very clear evidences of the CBCT, cone beam computed tomography or radiography, that how these implants behave. So, this is a perfect osseointegration in this particular case after few years. So, bone remodeling is a process by which osteoblasts or bone forming cells, they sense the mechanical signals, they get matured to osteocytes. So, you have that osteoblast, that is the primary bone cells or bone forming cells, and these are osteocytes, that is the matured bone cells. So, bone remodeling is essentially caused by mechanotransduction process, mechanotransduction like sensing the mechanical signals, and that essentially activates some downstream signaling procedures, signaling processes, so that this maturation from osteoblast to osteocytes that is accomplished. So, perception of the applied load to bone by sensory cells osteocytes, then signals into biochemical signals, receiving the signals by bone forming osteoblasts and resorbing osteoclast cells, and response of the aforementioned cells and a consequent of bone adaptation processes. So, bone remodeling essentially means that, as I said, this mechanotransduction process involving mechanotransduction process and then goes from osteoblast to osteocytes. So, this is the resorption, this is the homeostasis, this is the overuse, and this is a pathological overload. So, bone remodeling essentially is favored when the microstrain in the neighboring host bone is within some range, right. And as you see that if it is 50 to 200, the resorption is greater than formation, bone formation. Homeostasis resorption is roughly equivalent to bone formation. Then overuse resorption is less than bone formation, and even bone formation is facilitated when it is more than 4000 to 5000 microstrain. So, there the manufacturing processes can take place using conventional 9-axis manufacturing CNC machine that is being used very much state of the art, more advanced facilities. These are conventional manufacturing processes. There is also additive manufacturing processes are slowly being used, are being evaluated for making the robust. Okay. So, typically it takes around 2 minutes or less than 2 minutes to manufacture implant, dental implant. At least that is our experience. When I said less than 2 minutes, when you use this 9-axis state of the art CNC machine. Okay, additive manufacturing techniques in dentistry, what are the different techniques that can be possibly utilized there? So, one is the selective laser sintering or stereolithography, SLA, and also fused deposition modeling, FDM, photopolymer jetting or powder bed 3D printing. But I will be showing you later that how additive manufacturing technique has been used to eliminate in our collaboration with some of the manufacturing partners. So, majority of the dental implants for patient care currently being manufactured using CNC machining. Now, once the implant is manufactured, these implant surfaces need to be treated, surface treated, and the surface modification can be done by conventional technique is by sandblasting, and that is by acid etching. So, this is a very commonly used technique. It is called sandblasting acid etching. You can take the sandblasted dental implants and you can put it inside the acid solution. Then laser radiation, like you can focus the laser beam on the metals on the metal implant surfaces, you can treat them. So, this is the laser irradiated metal surfaces. There is also a process called anodization, TiO2 layer formation on the very superficially, and then plasma spraying, that is that this particular dental implants essentially is plasma sprayed and hydroxyapatite can be deposited. So, this plasma hydroxyapatite coated dental implants, and hydroxyapatite coating is done for better osseointegration of these implants. So, what you can see on the right hand side here. So, this is the rough and polished combination. This is that 3D textured implants which is also commercially used. Then you have a polished dental implants, you have a roughened, sandblasted and hydroxyapatite coated. So, hydroxyapatite coated implants, as I said, that is coming from plasma spraying of hydroxyapatite, so that you can get this hydroxyapatite coated implants. Okay, so, what is the other surface treatment modification strategy? So, although it has not been clinically used very extensively, researchers have tried organic coating on the implant surfaces. This organic coating essentially have growth factors and combination of growth factors and combination of ECM proteins and polysaccharides. ECM is the extracellular matrix protein and polysaccharides, and then it is again essentially coated on the dental implants. So, there is also inorganic coating like hydroxyapatite, as I mentioned to you, calcium phosphate, magnesium or graphene or carbon nanotube or nanodiamond. So, many of these things have been investigated to a very small extent research wise, because their safety and efficacy is a primary concern to any clinicians whenever you say that you are using graphene, carbon nanotube and nano diamond, although they look very attractive from the materials innovation perspective, but clinical practice is very different from what we do in the typical university's research laboratory. So, what is the other things people have done just to get this antibacterial efficacy of these implants? People have doped silver to hydroxyapatite, and by doping silver to hydroxyapatite, the silver based hydroxyapatite or essentially silver doped bioglasses that can be coated. So, what I was trying to what I am trying to say is that the silver doped hydroxyapatite or bioglasses bioglass coated implants that can be used for anti-infection purpose, because this should have antibacterial properties and therefore it can be used for this in anti-infective dental implants. These are like different nanotopographies which you can preferentially introduce on the dental material on the dental implants, and then you can see these kind of pillars, right. These pillars have some top diameter here and then some length, and it is like 5 micron, and then there is also certain nanotopographic features like holes or these kind of alternative very regular patterns that has been used, on the dental implants. So, all those things can be done using the manufacturing tools people use in the field of nanotechnology. So, those kind of processing tools can be used to introduce this kind of nanotopography on the dental implants. However, I am not aware that this kind of nanotopographies in the clinically used implants are used to a great extent. Then there is a other different type of topographies that you can introduce to mimic the extracellular matrix of tissues by pillars, pits, groups and gratings, that pillars, pits, groups, then tubes and fibers and wires and also by roughening. By roughening like sandblasting, this is like wires and these are like electrospun fibers. That electrospun fibers are also used or also investigated to introduce this surface modification. And this you can see this manufactured dental implants in India in one of the GMP facility. They have this 9-axis CNC machine, and these are like dental implants. These are like metallic dental implants. And then when they are supplied to the clinicians for the clinical study, they are put it into a medical grade glass vial. Then this implant holder titanium and the assembly and glass vial packed in blister pack. It goes for gamma sterilization, this primary packing, secondary packing, gamma sterilization, and then it goes to the clinicians when they place these implants into the patients. So, what are the mechanisms? Since sandblasting acid etching, I have mentioned you before, SLA technique has been most widely used. I would like to substantiate this particular technique little bit more. So, you have a sand grains, you can alternatively use alumina or zirconia. So, mostly people use alumina particles because they are harder particles, much harder than zirconia. So, what they do these micro dimples by impact, right. So, this is a sandblasting machine. So, it is a kind of impact or erosion. So, you can essentially use a erosion tester for the sandblasting machine. So, it will erode away very preferentially the metallic surfaces or material surfaces at the point of impacts. Now, the sandblasting once it is done, so essentially you can do it like erosion tester, or you can use a nozzle which will direct these particles at the implants at a high velocity. These are blasting particles, and then you can put it in the acid solution. This acid can be various combination. You can use HNO3 HCl combination, for example, in a specific ratio, and then implant with the buster surface has been immersed for specific time. So, etching time is also important. etching solution composition is also important, and then it will give you these etched surfaces. So, I will continue with this surface modification strategy for the ceramic implants in the next lecture. Thank you.